Have you ever wondered what deep vein thrombosis is and why it's such a significant health concern? Picture this, a dangerous clot, lurking in the deep veins of your leg, poised to wreak havoc. This is not a scene from a thriller movie, but a reality for many. Deep vein thrombosis, or DVT, is a serious medical condition that affects thousands each year. But why should you care? Why is understanding DVT so important? Stay tuned to learn more about this critical medical condition. Deep vein thrombosis, often abbreviated as DVT, is more than just a mouthful of medical jargon. It's a condition that can quite literally stop you in your tracks. But what exactly is DVT? Let's break it down. Deep vein thrombosis is a medical condition that occurs when a blood clot forms in a vein deep inside your body. While these clots can develop anywhere, they most commonly occur in the lower leg, thigh, or pelvis. Now you might be thinking, a blood clot? That doesn't sound too serious. But here's the kicker. It is. These clots have a nasty habit of breaking off and journeying through the bloodstream. If a clot reaches the lungs, it can cause a potentially life-threatening condition known as pulmonary embolism. This is when a blood clot gets lodged in an artery in the lungs, blocking blood flow. It's a serious situation that requires immediate medical attention. So, we've established that DVT isn't just a complex term to impress your friends at trivia night. It's a serious medical condition that can lead to grave complications if left untreated. The good news, however, is that with early detection and proper treatment, the prognosis for DVT is quite favorable. Now that you know what DVT is, you might be wondering what causes it. Let's find out. A myriad of factors can contribute to the development of deep vein thrombosis. First and foremost, prolonged inactivity can be a primary culprit. Let's say you're confined to bed for a long time due to an illness or after surgery. Or perhaps you're on a long flight or car ride. In these scenarios, your leg muscles don't contract as often as they should, which slows down your blood flow and increases the chances of clot formation. Injuries to your veins, like fractures or severe muscle damage, can also provoke DVT. When a vein is damaged, the inner lining of the vein wall becomes exposed, triggering a process called coagulation. This is your body's natural response to prevent excessive bleeding, but sometimes it can go into overdrive, leading to the formation of a blood clot. Certain surgeries, particularly those involving the legs and hips, pose an increased risk. During these procedures, your veins may be handled or even damaged, which could result in clot formation. Additionally, the recovery period often involves extended bed rest, doubling down on the risk. Genetic conditions also play a significant role. Some people are born with disorders that make their blood clot more easily. For example, Factor V Leiden and prothrombin gene mutation are two common inherited conditions that increase the tendency of blood to clot. It's important to note that while these factors increase the risk, anyone can develop DVT. Age, obesity, pregnancy, hormone therapy or birth control pills, smoking, and even sitting for long periods, like when working from a desk, can all contribute to the development of DVT. So, it's not just the bedridden or the injured at risk. You, me, anyone can be affected, especially if we have more than one of these risk factors. It's a silent condition that doesn't discriminate. Knowing the causes is half the battle, but recognizing the symptoms is equally crucial. Deep vein thrombosis can be a silent threat, but there are signs to watch out for. Imagine an unseen enemy lurking in the shadows, ready to strike when least expected. That's deep vein thrombosis, or DVT, for you. However, like most adversaries, it often leaves clues of its presence, if you know where to look. One of the most common symptoms of DVT is swelling in the affected leg. This isn't just your garden variety swelling from a sprain or a long day on your feet. We're talking about a sudden, unexplained swelling that doesn't go away with rest. It's as if your leg decided to throw a party and forgot to send the memo to the rest of your body. Another telltale sign is pain. Now, we all experience pain differently, but with DVT, it's often described as a cramp or Charlie horse that doesn't let up. It's like running a marathon, but only in one leg, and without the satisfaction of crossing the finish line. This pain might worsen when you stand or move around. Tenderness over the affected area is another clue. This isn't your typical tenderness that comes after a workout. It's a sensitivity that seems out of place, a discomfort that lingers even when you're not using the muscle. Lastly, let's talk about redness. If your skin over the affected area turns red or discolored, it might be a red flag. It's as if your skin is trying to alert you to the trouble brewing beneath. But here's the real kicker. Some people with DVT don't experience any symptoms at all. That's right. This sneaky condition can sometimes fly completely under the radar, making it all the more important to be aware and proactive about your health. If you notice any of these symptoms, it's critical to seek medical attention immediately. But what happens next? Treatment for deep vein thrombosis aims to prevent the clot from getting bigger, breaking loose, and causing pulmonary embolism. When it comes to treating DVT, there's a range of options to consider. First off, we have medications. Anticoagulants or blood thinners are the most common medicines for DVT. They decrease your blood's ability to clot, preventing the existing clot from growing. They also stop new clots from forming. However, they can't break up a clot that's already formed. That's where thrombolytics come in. These are drugs that do break up clots, but they're only used in emergencies, as they carry a high risk of severe bleeding. Moving on, we have compression stockings. These stockings are designed to gently squeeze your legs to prevent blood from clotting. They also help to reduce swelling and pain. They're often used alongside anticoagulants for the best results. Now, it's important to note that surgery is rarely used to treat DVT, but in severe cases, doctors may recommend a procedure called thrombectomy, where the clot is surgically removed. Another option is a vena cava filter. This is a small device that's placed in the vena cava, the body's largest vein, to catch blood clots before they reach the lungs. It's also worth mentioning that lifestyle changes can play a key role in managing DVT. Regular exercise, a healthy diet, and quitting smoking can all help to reduce the risk of DVT. Remember, early detection and treatment are crucial when it comes to DVT. If you suspect you have DVT, seek medical attention immediately. Don't wait for the condition to worsen. The sooner you start treatment, the better your chances of preventing serious complications. And that brings us to the end of our discussion on the treatment options for DVT. It's clear to see that there's a lot to consider. But with the right treatment plan in place and a proactive approach to managing the condition, people with DVT can lead a normal and healthy life. With the right treatment, people with DVT can lead a normal and healthy life. Deep vein thrombosis is a serious condition, but knowledge is power. It's a condition where blood clots form in deep veins, often in the leg. Factors like immobility, genetic predispositions, or hormonal changes can trigger it. Symptoms such as swelling, pain, or skin discoloration should never be ignored. Treatment generally involves anticoagulants, lifestyle changes, and in certain cases, surgery. Stay informed, stay vigilant, and remember, your health is in your hands.